Hello.
Good morning, Mr. Jones. How are you?
I'm well. How are you?
Fantastic. I'd like to perform mouth care on you. Is that okay?
Yes.
I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. I'm going to use a paper towel as a barrier to put the head of the bed up, since my hands are clean and the bed controller is not. Once we get the patient to an upright sitting position, I can throw the barrier away and then adjust the pillow so it's a little more behind his back rather than his head. There we go. Good?
Yes.
Okay, let me go get the rest of my supplies and I'll be right back. I'll gather my supplies. We're going to start with a barrier, and that gives us a clean place to place our clean supplies. So we're going to open the barrier up. And I also need a towel. We're going to get an emesis basin, a toothbrush, toothpaste, and a cup of water. And we also need a pair of gloves. I'm going to get my toothbrush prepared by wetting it and putting toothpaste on, and then storing it in the emesis basin until I'm ready to use it. Mr. Jones, can I place this towel over your chest?
Yes, please.
Thank you. This is just going to help keep your clothing clean. I'll put my gloves on. And now we're ready to brush your teeth. I'm going to brush the top, the bottom, the front, the back, and your tongue. So can you open wide for me? I'll start in the back, on the top, both sides, and then the bottom, both sides, the front, both top and bottom. And can you bring your teeth together? Thank you very much. And then stick your tongue out. Thank you. I'll set this aside, and now we can rinse. Go ahead and take a sip. Another sip?
Yes, please.
Okay. I'll pour the water in the emesis basin, set them on the table, and then I'll take this towel away and put it in dirty linen. I'm going to go clean my basin. We'll clean the emesis basin by dumping the saliva into the sink, rinsing the basin, setting it down, and disinfecting per facility policy. Then we'll take a paper towel to pick it up, a paper towel to dry the inside. We'll throw that paper towel away. Paper towel to dry the outside, throw that paper towel away, and one for the drawer. Now I can return the basin to storage, putting the toothpaste in the basin and using a paper towel to open the drawer to store the basin back in it. We'll close the drawer with a paper towel and then throw those paper towels away. All of these disposables will be disposed of. I'm going to go throw this away. I'll be right back.
Okay.
Now I can remove my gloves. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Okay. Bed is in the low position. Your environment is clean. Let me get your call light for you. Would you like a magazine before I go?
No, thank you.
Okay. Here's your call light. If you need anything at all, just press that red button. We'll be happy to come in and help. I'm going to go open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done.